let me guide you about diabetes. Diabetic cannot consume food. Yes, of course, it's false. You can consume food. It's a fructose sugar. It will not react with your insulin. But there is a way, even for normal people. If you are consuming fruits after your meal, like breakfast, lunch, or dinner, it will increases the glycemic load. So whenever you are consuming fruits, try to before meal. If you are try to take as a dessert, it will be harmful, even for normal people. So be careful whenever you are eating next time fruit, not after the meal. All artificial sweetener can be consumed by diabetic. No, not at all. Try to avoid. These are not good because these are working with cold temperature. They are meant for releasing their chemicals for the cold temperature, not for hot. And chai hum log garam peete hain, so it's not a good idea. It has sucralose and it's not a good idea. Diabetes cannot eat rice. You can eat rice, but वो राइस आपका बासमती नहीं होना चाहिए, प्रोसेस नहीं होना चाहिए, सुगंधित नहीं होना चाहिए, रिफाइंड नहीं होना चाहिए, सुंदर नहीं होना चाहिए. It should be from खेत. आपके खेत से आना चाहिए, रॉ आना चाहिए, पारबॉइल्ड आना चाहिए. I'm not talking about brown rice. बासमती को आजकल लोग ब्राउन कलर करके उसको एज ए ब्राउन राइस बेच रहे हैं, हम लोग खा रहे हैं. Wrong. You can have rice. साउथ में तो स्टेपल फूड इज राइस ओनली. नॉर्थ में व्हीट इज ए स्टेपल फूड. तो साउथ इस तरह से तो साउथ इंडियन सबको डायबिटीज हो जानी चाहिए. So you can have rice, but the rice quality matters. Diabetic should avoid carbohydrate. No, not at all. Yes, simple carbohydrate and complex carbohydrate. You have to be very careful when you are normally eating, not only for diabetic patient, for normal person also. More should be complex carbohydrate because it has fiber, it has high glycemic load, which will sustain, which will bind your insulin properly. And you can consume your complex carbohydrate easily. There is no problem in that. And I told you, आपको नींद अच्छी आनी चाहिए, carbohydrate ही आपको अच्छी नींद दिलाएगा. So that is important. I explained serotonin level during that slide. Diabetic can consume alcohol. That is partially we can say because number one, mild diabetes hai, moderate diabetes hai, severe diabetes. That depends on that and what kind of medication you are taking, what kind of alcohol you want to consume, wine or alcohol, whiskey, vodka, what. So that depends on your severity. It's important. Bitter tasting food, Karela, neem will lower. It's not true. सारे वेजिटेबल में अच्छे माइक्रोन्यूट्रिएंट्स हैं, अच्छे फाइबर हैं, अच्छे फाइटोन्यूट्रिएंट्स हैं. So all the vegetables are healthy for diabetic and non-diabetic patients. So nothing related कि diabetic खा सकते हैं और non-diabetic नहीं खा सकते हैं. So these are the myths I debunked.